So myself and Justin will do our best to speak clearly and slowly so they can sign what we're saying. If you ask a question at any point, could you please speak clearly and slowly? And if you're on the call and you need to see the two people signing, if you can't, please put in the chat if there's a problem, just so we know, and we'll do our best to sort it. And in fact, if there's any issue, any concern with this call, please pop it in the chat and we can then do our best to resolve anything as quickly as possible. So just to say again, we are recording. Please pop your microphones off unless you're called to ask a question. Please don't interject with a question until you're called. There's a lot of us and we want to keep it nice and calm. Please pop your camera off. I can see lovely John Hurlston's face. Hi, John. Could you please pop your camera off for now, though? However much I like to see your lovely smiley face. As ever with the Northfield Ward Forum meetings, everybody's welcome. Let's just behave well with each other. Let's have decency. All questions are welcome as long as they're in good faith and asked in a way that's kind. So let's keep it to that. As ever, if there is any problems, I'm always happy to pause the meeting if anything rude happens and stop it. But I'm sure we're not going to have that. I'm sure we're all going to behave really well. So I'm going to hand over in a minute to Justin, but just quickly, I just want to say a huge thank you to all of those putting the work in to pull all of this together and supporting our area. So Justin, who you'll hear in a minute, has done an incredible job, as is the Cabinet Member for Health, Paulette Hamilton, who's been amazing. Also, just a big shout out to Northfield Community Partnership and B31 Voices, keeping us all informed, and Josh from our MP's office, who's been so helpful every time I've asked for support over the last few days. So this is a special meeting called to keep you informed about the South African variant of COVID in our area, which will be why you're here. Justin's going to run through all of the points on it. Please pop your questions in the chat as we go along, and Justin will look to answer them at the end. We'll then move into a bit more of a time of Q&A. If someone else has asked your question, please don't ask it again unless there's another point that hasn't been asked on it. I hope that's clear. Justin, I think that's everything from me. I'm going to hand over to you. Thank you.
Good evening, everyone. My name is Justin Varney. I'm the Director of Public Health for Birmingham City Council. I'm going to talk to you tonight about the new South African variant of coronavirus. I'll talk first about variants of concern, then specifically about the South African variant, and then about Operation Eagle in Birmingham, which is the additional testing that you have seen and heard about in the last couple of days. Variants of concern are versions of the virus which are either more infectious or put more people in hospital or cause problems with the vaccine. Viruses change all of the time. Most variants make the virus weaker or less infectious, but sometimes we have variants of concern where these things are stronger and potentially more dangerous. There are variants of concern in 4 countries across the world. In the United Kingdom, we have a variant of concern from Kent and London that appeared before Christmas. That was more infectious than the previous version of COVID. There is variant of concern in Japan, in South Africa, and in Brazil. The variant from South Africa is more infectious, but it does not appear to make people any sicker and the vaccine still works, but not quite as well, but still pretty well. When we identify...
Sorry, Justin, I'm just going to leap in and sorry, Stephen Young and Lynn, is it possible for you to pop your cameras off just so we can see the sign language interpreter more clearly? If you can't, that's fine. But if you can click the little button on the top right of your screen that looks like a camera, and then your camera will go off. Sorry, Justin. Thank you very much.
We identify variants of the coronavirus by doing additional examination of the test.
Maybe we could take some flowers with us to help the business show what we can do. Thinking.
So,
and while I'm bringing flowers for the
sorry, I will start again. The TV put me off. So, we identify variants of concern where we see someone who tests positive, and then we look at the genetic code of the virus. That takes an additional 7 to 10 weeks. And that is why we know we have cases of the South African variant, but it has taken a long time to find out that they were different. The testing still told people that they were positive very quickly. And they were able to isolate and not spread the virus because they knew they were infected. However, when we've identified that they had the South African variant, we were unable to connect them to South Africa or to travel. And therefore, there is a missing bit of the jigsaw. Which means we are concerned that someone else in the area may have the South African variant, but not know it, and therefore we need to find if there are any more cases. This is the same approach that is being taken in 10 other areas of the country. Where we have cases of the South African variant and they do not connect to travel and they do not connect to each other. So nationally, Operation Eagle is happening where we test about 10,000 people in the area around the cases to try and identify any more cases to find the missing piece of the jigsaw. We have identified a specific area of the city in which we are looking for these cases. And we are asking all adults over 18 if they have no symptoms to get a test. This is the PCR test, which is the swab to your nose and your throat that is sent away to the lab, and you get your result within 1 to 2 days. You can access a test at the St Modwyn site on the Longbridge Business Park. And they are managing that site to ensure that it is COVID safe and that people are distanced. If you go to the site, you need to take your phone and a pen and hand sanitizer, and you should be wearing a face covering. You can drive to the site or you can walk to the site. There is another site that will open tomorrow at the Empire Cinema car park. These sites are open, the Modwyn site from 8 until 4, and the cinema, we think, from 10 till 4. We are trying to get it to open longer. You can also collect a test to do at home from the Hollymore Community Centre between 8 AM and 6 PM. If you do the test at home, you must return it to the Hollymore Centre before 5 o'clock the next day, so we can return it back to the lab in time. If you have symptoms or you are isolating, so if you have symptoms, then you should get a test by ringing 119, and they will direct you to a different testing site, or they will send you a kit through the post that you can return through the post. We are hoping to open more testing sites next week, and we were also hoping to start to offer door-to-door testing kits being dropped off and collected the same day in areas where testing has not gone well. It is important that people take a test within the next 10 to 14 days, but it does not need to be tomorrow. You should not book a test if you don't have symptoms through 119. Because they will send you to the symptomatic testing site and the sample will go to the wrong lab. If you have tested positive for COVID in the last month, you do not need to test again. We have drawn the map to be very generous in the area that is covered. So if you are not inside the affected area, you do not need a test and you do not need to worry unless you work inside the affected area and you have been to work, in which case you should get a test as well. We have information on the council website which tells you where the testing locations are, and that is updated when we open new sites. There is also information for schools and businesses on how they can get testing kits to use on site for staff. Deliveries to schools and workplaces are only on Monday to Thursday because the test must be done within 24 hours and returned to the lab. So if we gave them kits on Friday, they would need to be open on Saturday for us to collect them. We are not testing children at this point because secondary school children are tested in school with lateral flow. And because the South African virus is more infectious, like the Kent virus.
Sorry to interrupt, Justin. I think we've lost one of our interpreters. Wayne, are you okay to take over? Stephen Young, you are a guest on the call. If you can possibly try and turn off your camera, in the right-hand corner, there'll be a picture of what looks like a camera, and if you just click on that, it interrupts the size of the picture for the interpreters.
Hi Lois, I'm still here on screen. If anybody who's accessing the interpreter wants to click on me, there's 3 dots on my square and they can spotlight me. That way I shouldn't shrink.
Brilliant, Kelly. You did pause for quite a while then, which is why Wayne's taken over. Okay,
that's fine. I'll continue at the same time. And then.
Brilliant, thank you, Stephen. Okay. You've done it. Brilliant, thank you.
Great. So, as I was saying, we are not testing children because the new variant is more infectious and it would be unusual for a child to be positive and the parents not to be positive. That may change in time, but at the moment we felt it was important not to test children unless absolutely necessary. You do not need to isolate while you are waiting for your test results if you have no symptoms. And school and work and vaccination continues as normal because the same risk reduction is needed for South African variant as for the new Kent variant. And currently, about 80% of new cases in Birmingham are from the Kent variant. So everything that we do with hands and face and space that stops the new Kent variant spreading will work for the South African variant. So now I'm happy to take any questions, but I would encourage people to check regularly on the website to see for any updates of testing locations across the city and frequently ask questions.
Thank you, Justin. Just to leap in before you take, so there's a couple of questions already in the chat, but I've had a couple of messages saying some people on the call can't see the chat function. So what you can do if you can't see the chat function is you can raise your hand. So there's a button on the screen, you raise it and we will see it. The third option is, I imagine most of you are on the call because you've seen the social media on this. If you can't ask your question in the chat or raise your hand, message me on social media and I will then put it at Justin. I want everyone to be reassured at the end of this meeting and I don't want to miss your questions. So Justin, can you see the couple of questions in the chat, Justin? Or do you want me to go through and read them?
If you could highlight them. I tried to answer them as I was answering the question.
You possibly did. I was also answering text, so I might have missed it, as people said they couldn't see it.
So Sylvia asked about, she was scared of going out. And I said it is important that we all follow the rules at the moment. The new virus means that people who are infected have more virus in their body. So the droplets from their mouth and from their nose are full of more virus, but they do not go any further. So the 2 meters is still enough distance to avoid the droplets landing on you. The face covering will still keep the droplets close to a person's face, and the washing of your hands regularly will stop you taking the virus from something you've touched and putting it onto your face.
So if you have any further questions, you can pop them in the chat. I think you can say to raise your hand. As I can't see any, there's one there about young people but not children, Justin, if you can see that. I'll leave that to you. Then I'm going to come in and make a point as well.
So young people at school and college, in secondary college or at university are now being tested regularly. And because of that, we think it is unlikely that they will have a case that we do not know about, because in secondary school and college, they are being tested every week already. And if they tested positive, then they do a PCR and they are looking at the ones that have been done in the last month to see if any were South African variant. So at the moment, we are not asking people under the age of 18 to test. If they are not in college, then I would say it is okay for them to get a test. But still, the risk is relatively low. If they are not in college and not living at home, then and they are working, then I would say get a test like anyone else who is working.
Thank you. That's a really, really good question and good point. Justin, I just want to leap in there as well and say, any of you who engage with me on social media, you'll know I'm relatively active on there. So while this has been happening, and while Justin and Paulette and the team have been putting a huge amount of things in place rapidly, I've been watching the conversations unfold. So I just want to speak to a couple of the things we're seeing online. So firstly, if Justin's explained something, but if it doesn't fit with your experience, or if something's not working the way we've said it should be, shoot me an email, or Gary, who's on the call, who's the MP. Let us know. There are many moving parts. The team are working as quick as they can, but some things may fall through the cracks. Just let us know. Also, just wanted to say, one of the things I've spotted quite often on social media over the last few days, and in fact the last few months, is conspiracy theories. So there's still a lot of people saying things like you don't need the vaccine, you shouldn't have to get tested, and COVID is not terrible. So just to answer that, I think we all need to find ways to either challenge that or not repeat it. So I would like to challenge all of you. Please don't be reposting or sharing things that are saying that this isn't serious. It is. I just had a month off work being really sick. I've got good friends who are really sick right now. We do need to combat that, and we do need to encourage people to get the vaccine when they are entitled and offered it. It's vital we do that to protect each other and the NHS. As I say, I'm aware there's a lot on Northfield social media right now That's saying don't get a test, don't get a vaccine, it's not serious. Do get a test. If we've asked you to, please get one. Do get the vaccine, and it is serious. Justin, one of the things I've seen some people asking is, what's the dangers of everyone piling into the sites right now, of the potential of then cross-infection there? So yeah, how safe is it for everyone to get to the site?
So at all of the sites, we have people who manage the queue and encourage people to keep the social distance. Of course, the queues are outside, which makes it much lower risk than if people were queuing inside. And the important thing is that everyone takes responsibility to keep the distance when they are queuing to get a test.
Thank you. And just to add to that, I live right beside the St. Modwen site. I've been out twice at distance on my puppy walk, and it's an incredible setup. They're keeping their distance. The staff are great. I spoke to the site manager, and in fact, they're looking to keep tweaking it to make it even better. So it's absolutely safe. As Justin said, get your test if you're in the zone. If you can't get out to get it, as Justin said, we're working on getting it to you. I was interviewed yesterday about what's going on the news, and what was interesting was the journalist kept using the word concerned. How concerned should we be? And there's a lot of that on social media, and a few people have messaged me saying they're feeling anxious. So just as your local representative and as your neighbour, someone who lives within this zone, I just want to say now's not the time for concern or anxiety. It's simply to trust what's in place. It's to work with pragmatism and precision. Justin and his team are on this. We're on this as a community. So this isn't about concern and panic. It's about working to the system and just catching this. But if you are anxious, email me as councillor, Gary is your MP. We'll get the right people there to support you via email or social media, because it is a tough time. Justin, a couple more questions have just popped up, so I'll hand that back to you.
Yeah, so Chloe has asked about nursery schools and early years settings, and about what if parents don't test and are still sending their children. We are encouraging all parents and all adults to test. We can't force people to test, but we are strongly encouraging them. It is important to remember that this new variant from South Africa is very similar to the additional risk of the variant from Kent. So it is not more deadly, but it is more infectious. So in terms of reassuring your staff, Chloe, it is about trying to stop the spread of a new version of the virus, but it is more because it is new than because it is more dangerous. And all the things that you are doing to protect your staff and the children you care for already apply the same. There's a question from Denise about, if the cases were 7 weeks ago, how come we only find out now? And because I've said before that now we will get the answer on whether it is South African variant in 10 days, which is a good question, Denise. And I'm glad you are listening to me on the calls. So the reason is, up until last week, we had not got a form of... Sorry,
Justin, I think we've just lost Kelly again. Wayne, are you available to step in?
Thank you. So Denise was asking, how come it's taken 7 weeks to find out about the South African variant, whereas now we can find it in 7 to 10 days? The reason is because over Christmas, we were sampling 5% of all of the positive tests in the country and putting them to check their genetic code. And when we have the map of that genetic code, we can compare it against the global database to see if it is a variant we recognize. When we are doing that for all different types of variant, it takes 7 to 10 weeks. Now we have one laboratory looking for one pattern of the genetic change. So the positive cases, they are looking for one section of the genetic code, not trying to read all of it. And so it can be done much faster. And that's why now we will find out if these are South African cases about 10 days after the person tests positive.
Thank you, Justin. I'm pleased I said to contact me on social media because some are struggling to get their questions in and struggling to raise their hands. I'm going to ask you these two questions I've been texted, and then if we can leap to Paulette's question, and then I'm going to go to the three people with their hands up. So the questions I've just been sent, Justin, are, sorry, I've gone off the page. Will the area, will the area be expanded on? Oh, it depends on cases, doesn't it? But will the current area be expanded upon?
So we have defined the area in discussion with Public Health England, and it is very generous in the coverage to ensure that we try and catch all of the possible cases there might be. I think there are two likely outcomes. One is we find lots of cases of the South African variant, and it has already spread, not just in Birmingham, but also across the country. The other is we may find only a very small number, and if they are near the border of the area, then we may need to extend the area. But we will see how we go over the next week or two, and if we need to extend the area, we will.
Thank you. For those who very specifically messaged me about roads, that means it's one side of Hanging Lane and not the other. So it's not the side that comes down to Bodenham, and I think it means the north side of Bristol Road South, but we need to double check your postcode in the postcode checker. But when I've looked, it's my wards, the Northfield Ward side, not the Longbridge Westheath side of Bristol Road South. The other question I've just had, someone has been to Hollymoor and they were told they needed to test everyone in the house, Justin. So the staff there said test all the children, 13 and 10-year-olds.
So that I will get that updated, because children don't need to test and the staff should know that. So only people over 18 need to test, not just the children. So I'm sorry they weren't clear enough.
Thank you. But at least that over-vigilance is not problematic, is it? Thank you, Justin.
I would definitely prefer more people to test rather than less.
Absolutely. So Councillor Paulette Hamilton has put in the chat, can we address the question of people who are housebound in bed and cannot get to the test centre, please?
Yes, so there are two things to mention in terms of the housebound. So people who are housebound are likely to be very low risk, but it's very important that their carers do get a test. And we would encourage anyone who is leaving home to work in normal times, so when we are not doing this special testing, to be getting a lateral flow test every 3 days. But in this circumstance, we would encourage all the carers to get a test because they're working in the area. Next week, we will also be starting door-to-door offering test kits to people. That will be offered by people who have the right ID from the council, and they will have written information from the council, and they will be working in teams. Those test kits will be free, and we are keeping an eye out in case people try to take advantage and present fraudulent offers on this. So if you cannot get to the testing sites, please be patient. do not order a postal kit unless you have symptoms, because the postal kits go to a different lab.
Justin, if I could just address what may be an elephant in the room with door-to-door, because I think it's better to address it now, and you answered this really well in conversation earlier. We did door-to-door a few months ago and it was stopped because of a newspaper story about a one-off instance that, and so yes, just a hand over you, but that's obviously not going to happen again. We're on top of it, just to reassure people it's going to be done smoothly and well.
Yes. So unfortunately, last time there was a mistake where a used kit was given to someone who then reused it. We have made sure that in this process, the people giving out the kits give out their kits, and when they've run out of kits, then they go back to the beginning to collect the kits. So there is no opportunity for unused kits to come back into the hands of someone who is still giving them out. And that's to ensure that we have a one-way flow to avoid that risk happening again. You're still muted, Councillor Armstrong.
Sorry, just to say that was a vital point to make, to address some of the misinformation so people are confident and comfortable, because we need you all to trust us in this and to get this done. I have a couple more questions popped on. I don't know, I'm sure it's the same for you, Justin, and you're having many more meetings than me. Everything's blurred into one, so I can't remember if you've answered it or said this already. You may have already said this. Can you tell us about the letters that are going around? Because I've been asked about people who aren't on social media. Normally, in normal times, I'd put a letter around my whole ward. What are we doing with that? You may have said already.
Yeah. So we have sent flyers out from the council, which should arrive in people's letterboxes probably tomorrow, and if not on Monday at the latest. And these provide information, the link to the website, and also a contact number if people don't have access to the web to get information from our contact centre.
Thank you. And obviously, phone your friends, right? You know, obviously we can't see our neighbours and people are not in our bubble, but phone them and check. And there's no silly questions with your family and friends. It's in this situation, ask them. But also there's no silly questions for me or for your MP, Gary, who is on the call, or for Justin. So if you've got concerns about any of this, there are no silly questions. Just ask. We'll look to resolve them. There's two more points there from Ken and from Jason, if you can see them. So when we will get the feedback on this current load of tests, and will there be live data on any hotspots?
So we will get the first full information, I think, on how many tests have been done the middle of next week, and the first indication of how many are positive about Wednesday or Thursday next week. We won't know how many are South African variant until probably about 10 days after that. And I am happy to come back to the Ward Forum in about 2 weeks to give an update on progress and what we have found. If you want to find out about coronavirus in your local area, this will not tell you about the South African variant, but you can put your postcode into the government website, and I have put the link in the chat, and that will show you the cases in your postcode area.
So I've just realised I promised I would go to the hands that are up, but I don't know how you're managing, Justin, because I've done a third of what you've done, and I'm exhausted. Before I go to the hands, that's another point just for us to all bear in mind. Everyone's mentally exhausted right now, so again, keep checking in on each other. It's vital we do that. So Gemma is the person with a hand up first. Do you want to unmute, Gemma, and ask your question?
Hi, yeah, thanks so much. Thanks, Justin, Ollie and Kelly, bless you, for doing this. We've got a little issue in our community that I need to raise. We've got on the industrial estate in Franklin. I have emailed councillors and MPs. They have 145 people per shift twice a day. They're not being COVID friendly. Also, I have also told the council officials, is there any way that any factory over 100 can actually be given a test and sort of be made to give them, so they won't be promoting their staff to go and get this test? Which I can, quite a lot of people on I did join the other chat, but the other one, but I wasn't able to speak. So they're actually aren't being COVID friendly, and they're being sort of, I can't say threatening, but they're saying to their staff that they don't need to go and do these COVID checks. And they are, they're not a frontline factory, and somehow they slip through the government's loop, but they're able to be open. But it's a very strong community, which I raised back last March. And I just wondered if there's anything official that we could actually do with that factory in particular, by actually delivering the test to them and telling them that you'll collect them. Not you personally, but as a community, what can we do?
So can I just check, is the factory itself within Birmingham?
Yeah, it's on Franklin Industrial Park.
Sure.
Yeah, so it is Birmingham, but
Yeah.
As the management are the ones that are not allowing their staff to be COVID friendly. They're threatening with their jobs and everything, and sick pay and everything else.
Okay, so a couple of things. Firstly, we are writing separately to all of the businesses within the affected area to say they need to arrange for their staff to have tests, and they can contact us to book boxes of tests that will be brought to them. If we identify businesses that are not responding, we will be following them up. But more importantly, if you are aware of any employer in the city that is not treating its staff safely for COVID, please report it through the council website. It is anonymous, but we take it very seriously, and we have taken fines, and we've taken the health and safety executive. We have inspected and done unannounced visits to businesses. So please, if you know that there is not good COVID safety in a business, please report it to us so it can be followed up.
Thank you, Justin. One last thing. I went to Morrison's Rubery last weekend, and it was awful. And I said to a manager, aren't you going to try and control this? And his response was as well, we have to rely on the public to keep themselves safe from now on. And that, there must have been over 900 people in there, according to the figures. And the management response was, well, we have to rely on the public now.
So the council has been very vocal about supermarkets need to do more. And both the leader and Councillor Hamilton and myself have made a lot of noise about this with the national chains. And we have seen improvements. However, we are also moving our COVID marshals into the area more, so they can come and do some spot visits to increase the behaviour of the shops that are still allowed to be open, because they do have to enforce the guidelines, and it has been made very clear to them by government that it's their job, as well as the public's, to make sure that everyone is COVID safe.
So Justin, just to jump in there on Gemma's last point as well, Justin, you did ask us to set up a meeting with the businesses, which we're doing. And so, Gemma, to reassure you, I expect the supermarket managers to be present at that. If they're not, we'll be speaking to them. I feel that lots of places are trying their best, but it's been so long now that it's easy to slip. So I'm keen to reassert around some of our supermarkets locally that we reassert and reboot the system, because it's easy to slip, right? It's easy to slip. There's a couple. So there was two people with hands up, and I forgot to come to them, and they put their hands down. But if they want to ask something, there's Jason, I think, and then Gary. I've got Gary down, but I had Jamie and Steve G, and then I'm going to come to Gary. Jamie and Steve G, if you are there still, unmute. No, one quick thing.
I think, sorry, Ollie, I think it was Jason.
Or was it? I've just written it down wrong. That's fine. We're going to wrap up relatively soon. I am going to come to Gary, and there's some more questions in, but I'm aware Justin must be exhausted, and there's still more to come in the coming days. So get your questions in. Gary, I'm going to come to you in a minute. And we'll try and answer the last few. But also, just on the point about factories and work, I've had a couple of people already emailing me saying their bosses have told them not to come in to work because they live within this red zone, and they've also potentially been told they may not get full pay. Now, that's absolutely not right. I'm looking into that. If you know anyone who in this situation are being not paid properly, or are being not paid at all, or told not to come in and they're not getting money to put food on the table, email me straight away and we will get straight on that. Just going to hand over. I think Gary's going to either ask some questions or make a point. Thank you, Gary.
Thanks, Ollie. On the businesses front, I think that's a very important point that Gemma made. And I know I rang a business yesterday after someone telling me that they weren't complying properly and had a stern word with the business owner. So I'm sure that if anyone else wants to send in any more information to me or to you, Ollie, we can pass it on to Justin, and I'm sure we'd either be happy to call them as well. But I was really wanting to come in at the end, but it was just to say thank you to you, Ollie, for your community leadership, and to Paulette and to Justin and all the team who over the last couple of days have been heroic and moved mountains to make sure that we get all of this in place very quickly to make sure that we respond to this locally. So thank you very much to everybody. As Ollie mentioned, both him and I are readily available at most times of the day, apart from those few hours of sleep we get. And we're happy to answer questions. And if we don't know the answers, as I cracked a joke in the last one, we know the mobile number of Justin, who equally answers his phone at any time of night. So thank you very much, everybody, for responding in the way that you have. And thank you, Ollie, too.
Thank you. We're not necessarily finished yet, just so people know, but thank you for those points. And please don't ring people at any time of the night. I get that sometimes. I shouldn't have my phone, that's my own fault. We're human, and Gary's human, and Justin's human, and we need to exist as humans. Just to pick up a point, as this is a Ward Forum meeting too, although an emergency one, as Justin's just said, he's happy to come back. We will take him up on that. But there's a number of points I want to address in the coming weeks, and I intend to over January with the Northfield residents. But I've been really sick. I know how bad COVID is. I've been really ill, so they've been put off. But as well as looking at this emergency situation, lots of people are losing their jobs, their homes, deep anxiety. So these are things we will look at in the coming weeks for Northfield Ward. And Justin's kindly said he'll come back in a few weeks. And we can potentially ask him some wider questions on these things. Very last chance. I'm always keen to say this because some people aren't the type they're timid and don't want to ask a question, right? But if you've got one in you that you want out now, I'll give you 2 minutes before we wrap up. So if you really want to ask one, put it in the chat, put your hand up, or you can even email me. Paulette, I'm coming to you right now. If you want to email my councillor email, which I will put in, I just want to make sure you don't go away from this going, I wish I had asked that question. Paulette, I'll hand over to you. My email is in the chat box, so you can email me.
I just want to thank everybody I can't believe it, with the 2 meetings I've attended tonight on this side of the city. I think there's been over 170 people that have attended either or both of the meetings. So I just want to say what a brilliant turnout. But the reason I wasn't going to say anything, but the reason I wanted to say a few words was relating to the vaccine. I am really keen that people, if they get their letters, they do not ignore it and not have the vaccine. Can I please encourage each and every person on this call, if you get the letter to have your vaccine, please go and get that vaccine. It is really important that we go forward as a community. We have the vaccine, which the NHS are leading on that, but we really do need, if we're ever going to get out of where we are at the moment, we need people to have the vaccine. And I just wanted to also say, please, even when you've had the vaccine, keep your distance, still wear your mask, wash your hands regularly, don't stop doing the things that you've been doing, because we have to as a community work together. And I just want to thank you all, because the last year, I have to say, has not been the easiest year, but public health and Justin leading it and all the councillors that have supported what we've been doing have been phenomenal. But can I also encourage you, if anybody feels that they could become a COVID champion, please consider it. It's at times like these we see the value of having people out there helping us to pass on the information. And I don't know if I've said this, but I'm going to say it again. Gary, Ollie, and all the other councillors, they have been phenomenal. They have come together, they've worked as a team, there has been no issues with differences, and I have been proud to be the cabinet member watching politicians work the way that they have over the last few days. And I'll stop there and right back to Ollie. Thank you, Ollie.
No, I mean, as ever, very welcome. It's lovely to have you on the call. So Jason's, I'm really sorry, Jason, I can't see your hand on my screen. Jason, if you're there, can you pop your mic on and ask Justin your question? I can see your hand now, but I've obviously got a glitch.
Hello there, hi. It was a question around the deployment of the marshals. I think it's a great idea to have a kind of a presence of marshals around some hotspot areas. I am concerned around the kind of some of the behaviours in around schools in terms of not really obeying some of the kind of COVID rules of thumb. Can we as a community perhaps put some nominations forward around where we believe marshals will be more effectively deployed, and send some communications out to schools? It's very difficult for school teachers, headmasters, and other support staff to always, you know, encourage that kind of adherence to COVID restrictions. But I think we have to really enforce some behavioural change at the moment to get some quick outcomes, because there is a lag around this data. And I think if we don't do it now, we are going to find the prevalence and incidence just merely going up.
Yeah, so we are working with the schools closely on this, and one of the things that we've been working with the schools on is about giving the schools some extra money to employ COVID marshals, particularly at the school gates. We did a pilot of this at the end of last term with a couple of schools in the city, and it was very successful actually. Parents were very positive about it, and of course it created a job as well, which is important at the moment. So I will follow up on where we are with rolling that out wider, because I know there was a lot of support from it from the head teachers, particularly because of behaviour at the school gates, where it's natural we see people that we don't get to see, and we want to have a chat, and people stand too close together, and that creates a risk. So we are very aware of that and working on it. If you see, I'm just thinking how to phrase this. So in terms of the COVID rules, the council is mainly responsible for when businesses don't do what they should. And the police are mainly responsible for when people don't do what they should. And we're working closely together, but that's roughly how the powers split. So we are working to bring more COVID marshals into the area and also across the city to support this, but in a very targeted way. As I've said, we are also working with the schools.
I've just had a couple more questions by text. We are going to wrap up really soon. Someone's just messaged and said it was great to access tonight with an interpreter. And I agree. I'm really grateful. It's something we've talked about at my ward forums for some time, and we've not yet fully worked out how to put in place, but we will be looking to use this more as we go forward. So it was said earlier that fines will be issued for cars parking at the Hollymoor site. Is that true? I've messaged back and asked, are they saying cars getting tests or just random people parking?
So we know that the parking site by Hollymore has got a ticket system. We are working with the owners to get that suspended to help people, so they don't get a ticket. But that has been worked on today, so it should be sorted by Monday, and hopefully there won't be any fines there over the weekend.
Gary's got his hand up. Is it to answer this?
Yes,
Thank you. Go on.
I spoke to someone from the church about an hour and a half ago, and if anyone wants to send in their registration plate, if they do get a letter, I can send it on to the pastor at the church, and he'll be able to nullify it from his machine and his computer.
Thank you, Gary. I thought someone sent another question, but I've got so many different modes of social media, I can't find it. I think we've done them all.
Someone's asked, shall I pick up the last couple of questions?
Yes, please.
Someone's asked about funding for local information. So we have the COVID champions for people to sign up to for information about COVID. That isn't a funding stream, I'm afraid. We have put out several commissions through the pandemic for support, particularly to particular groups. So we commission the Birmingham Institute for the Deaf, BID, to support access and engagement with our hearing impaired community. We commissioned the Bahu Trust for work with our Islamic community, and those were through open tenders on the Find It Birmingham portal. We may add more in the future, but it is important, if you are a provider, to register on the portal for those opportunities. There was also a question about a cleaner. So Mike asked, he saw a cleaner at my neighbour's shop. Should I be scared? No, that's someone just doing their cleaning. There is no special cleaning team that come out because of the South African variant. So I do not expect to see anyone on the streets of Northfield in the big sci-fi suits that we saw at the beginning.
Justin, just to pick up on that, actually, about things that freak us out in tough times, like spotting something that's normal, like a cleaner, but in this situation, you might think, oh, is it because of this? Again, if any of you have any questions, there's no silly questions. Don't send them to Justin, he's very busy. Send them to me, Julie Johnson, who's on the call, who's a councillor, Simon Morell and Frank, all your councillors from Northfield Ward. You'll find our emails online. In this pandemic, there are no silly questions. Can you see any more questions on the chat, or otherwise I'm going to wrap up.
There was a question, there was one question about a new strain called Ligma. I haven't heard that, Raoul. As I said, the variants of concern at the moment in the world are in Japan, Brazil, South Africa, and the United Kingdom. When new variants of concern are found, the government will let us know through the weekly briefings. But how do I say this? But I expect we will see more of these, and we will have to do more of this type of additional testing over the next year until everyone who is most vulnerable has had the vaccine. And that is why Councillor Hamilton is so right to stress that if you are offered the vaccine, please take it. And if you are concerned about the vaccine, we have a vaccine understanding session planned for the city. There are, I think, 7 more of these to go over next week. And I'm sure the councillors will be sharing the details. There is one specifically for the south of the city coming up. And please join that to hear more and get any particular questions about vaccine answered, because we want everyone to take up this opportunity to protect themselves, because not only will it protect your life, but it also makes it easier as the virus changes.
So I can see that Steve and Mike have their hands up. I'm going to ask you to ask your questions and keep them concise, just so we can wrap up soon. But Steve, can you go next, please?
My wife's got an extremely rare illness and she's very concerned about having the vaccine without speaking to her specialist consultants. Is there somewhere that she could get specialist advice without speaking to her consultants?
She should talk to her consultant who knows her best, I'm afraid.
Okay, thank you.
Thank you, Justin. Someone else had their hand up, but it was Mike, but that might be that you've answered the question while we were speaking. Well, so we're going to wrap up this. Someone has just messaged me, and we'll not do this now, but they've said Justin spoke about the COVID champions and can we publicise the link? Actually, as you're obviously all online because you're on an online chat, you've got internet access, go to B31 Voices. If you don't already follow B31 Voices, they're an incredible hyper-local news hub. On their page, they will have all COVID information, and Justin's put it in the chat. If you can't see the chat, go to B31 Voices. It's all in there. Right, we're going to wrap up. It's obviously an incredibly difficult reason to meet, but also it's wonderful to have so many of you on the call. I miss seeing you face to face. If you want to keep in touch about Northfield Ward Forum meetings as we progress, email me. I will put you on the contact list. It's ollie.armstrong@birmingham.gov.uk, OLLY. Again, it's online. Yeah, that's it. Thank you very much to Justin and for RMP Gary. It was good to see you at a ward forum. And is it? Oh, someone's talking.
Kelly, the interpreter. Sorry to interject.
Sorry.
Could you just repeat your email address for the participants, please, and a little bit more slowly? Thank you.
So my email address is Ollie, OLLY, .Armstrong. I'm too tired to spell my name. At Birmingham. .gov.uk. Thank you, Kelly, for interjecting there. Yeah, thanks to everyone. Keep your eye online. We'll keep you informed. Justin, I hope you get some good sleep, some good rest. See you all again soon. Thank you for coming. Good night.